So what exactly is erectile dysfunction? Well, the standard definition, it's the inability to obtain or maintain an erection that is firm enough to have sexual intercourse. So what is the mechanism of erection? Well, this is a graphical cartoon of the flaccid penis. You can see there's two chambers here that are responsible for providing the rigidity to an erection. And the urethra sits underneath here, and that doesn't get rigid, it just gains some girth. Blood flows in and fills these chambers and expands them. So it's like inflating a balloon or an inner tube, and basically it provides that, it expands that space and provides a rigidity. In general, just having the presence of prostate cancer doesn't cause erectile problems. But so at diagnosis, I mentioned that oftentimes there's a vascular cause as well. There may already be some degree of erectile dysfunction due to other causes. So what is a penile implant? Well, it's ideal for men who have tried other treatments without success, and even for men who are ready to try something that can be very effective. So the three-piece inflatable penile implant, what are the advantages? Well, first let me kind of show you exactly how this device works. There's two cylinders. They're made out of a silicone-type material. They go inside the penile shaft, and they're actually placed inside those cylinders that we showed you earlier that fill with blood. And they're connected by tubing to a control pump, basically, that sits within the scrotum. And it's well hidden. The scrotum actually has quite a bit more room than we give it credit for. And then there's a reservoir that's kind of a holding tank for a saline-type solution that goes behind the abdominal wall. And it's a circuit. So you have fluid that's stored up in this reservoir. You have nothing inside of these cylinders that are kind of deflated within the penile shaft. When you're ready for an erection, you hit this pump down here. See this little bulb? That moves fluid out of this reservoir along the tubing and fills this cylinder. So how do you get an erection with your natural tissues? Well, you get aroused, blood flows into those cylinders and fills them and makes them hard. Well, this is no different. You hit this pump, fluid, saline solution flows, fills those cylinders, makes them hard. So that's how you get an erection. When you're ready for the erection to go down, there's a pump or a little button right here. You press that actually opens up a valve, and the blood can then be, or the fluid can then be moved back out of the cylinders to empty them, and it's stored back here. So everything is completely contained within the body and concealed. So it is totally concealed in the body, and it looks and feels very much like a natural erection. You inflate it to provide that rigidity, and then the 99% of the time that you don't need an erection, it's deflated, it's very natural looking, and it's well concealed. There's nothing bulging in the pants. So the AMS company has come up with a coating called the inhibizone, and it's really it's the only prosthesis. It has clinical evidence. It's actually FDA approved for the reduction of risk of infection for penile implants. Now, it does require some manual dexterity, so you have to have some hand strength and the ability to manipulate this pump. So that's a reality. These devices are meant to last a long time, but not forever. So typically, we look at about a 10 to 15-year life expectancy out of this device. That's far superior from a lot of implantable devices, surgical implants. And usually, the problem is there's a mechanical problem with the valve, or there's a leakage of the fluid, which is really important for proper function. And the final thing is, of course, to get it in there, it does require surgery. 90% of patients report satisfactory prosthetic erections at 2 years or beyond with the inflatable prosthesis. So again, you can see this is a better picture, but there's a reservoir. There is the cylinders deflated and inflated for rigidity.